Nigeria reports more than 1,000 leprosy cases annually, a curable disease caused by the bacterium Microbacterium leprae. But without treatment, leprosy can lead to severe disabilities and disfigurement, and patients often face significant stigma.
I often have to fend for myself if there's no one to help me, and that affects the wounds. Before last year, my wounds were healing, but now they're getting worse. The pain is worse.
At ERCC Hospital in Nasarawa State, a shortage of medication resulted in the discharge of patients, increasing the risk of disease spread.
You know, the relapse will come when you start the drugs in most cases. Now that they have not even started the drugs, the most important thing is we don't even want them to run into complication. So complication is the most difficult aspect. You know, if they lost their finger, where are you going to get the finger and give them again? If they lost their sight, who is going to give them sight? So what we are afraid is even the complication. As they are staying without the drug, the disease is progressing day by day.
WHO data shows that Nigeria is one of 12 countries reporting between 1,000 to 10,000 cases annually, behind Brazil, India, and Indonesia. The disease is thought to spread through respiratory droplets and prolonged contact, so delayed treatment puts others at risk.
In the last, this is about a year now, we don't have leprosy drugs in the country. And this is the first time we are seeing this kind of very strange, very painful situation where leprosy patients who really, like I just said, they belong to the poorest of the poor, are not able to access this life-saving medication. For the first time, these drugs are meant to be free. They're meant to be brought in by WHO, and yet here we are, 1 year plus later, not having those drugs.
But with the expected consignment, patients like Awal Musa can give a sigh of relief because they can now begin the journey to recovery and avoid further permanent disability. Muturi Kaibere, CGTN.